Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hi, Dr. Andrea McSwain. Welcome to the Feel Better, Feel Great podcast, episode 129. I want to talk to you today about the kidneys. We're still on improving organ performance, and this is medicine for the kidneys. As we dive into the podcast, I want to remind you that while I am a medical professional, the information shared here is for educational purposes only. It is not a substitute for personalized medical advice. Always consult with your healthcare provider before you start on any healthcare activities. So let's enjoy learning about the kidneys. Okay, so the kidneys, we'll talk about the overview of the kidneys, their location, their function, their importance to the body. Then we'll look at some conventional approaches to the kidneys, and then we'll look at some holistic approaches to the kidneys. Which is, I think, fascinating and also about helping the kidneys heal. So have hope. If you have received any kind of chronic kidney disease diagnosis, then I really hope that you listen to this, because a lot of times, especially with organs, we're told oh, that's just how it is. And that's just not exactly how it is with chronic kidney disease. You can reverse it if you know how. So let's do that. First of all, understanding the kidneys. They are located in a very important place. They're actually in the back, one on each side. They're retroperitoneal, so they're behind the peritoneal lining of the abdominal cavity. So they're really tucked in tight and really kind of in an adhesive state in the mid-back. Just underneath that 12th, just on the inside of that 10th to 12th rib, and they are about this big, maybe something like that. And so they're not as large as you think, probably. And also they are in a particular spot where they can really get trapped when the ribs are having dysfunction, when the diaphragm's having dysfunction, when you're having back pain. Some of the muscles are really tight. So that's important to know the location. The function is only half the story of what we actually know about what they do. So we think that they process urine, but they're also a really important endocrine function. They regulate electrolytes. They help us process vitamin D. They help us with our blood pressure. They're very important organs. They look like kidney beans. They have common kidney conditions, which can include chronic kidney disease, or CKD. There's kidney stones. There's acute kidney injury, and then there's a urinary tract infection. So we'll talk about some of those, and I'll highlight some features. From a conventional medicine approach, we, again, think about the kidneys as just organs that filter urine. That's about all of it. Nephrologists are the doctors that are specially trained in mostly dialysis and also appreciating high phosphorus levels. So a nephrologist is the doctor that some people see with conventional medicine. So how do we find out if the kidneys are having a problem? Well, luckily, because they filter blood and they filter out urine, we have a lot of good ways to understand what's going on with them. First of all, we can look at how much they filter, and that is called the filtration rate. It's actually called the glomerular filtration rate. The glomerulus is actually the working mechanism within the kidney. And so the glomerular filtration rate can tell us how well the kidney is functioning overall. And then there are certain levels that can tell us how the kidney filters waste. So that's creatinine, and also something called blood urea nitrogen, or BUN. And that helps us understand the kidney's function. Other things we can look at for what's happening in the kidney, if it's related to measuring protein levels, is albumin to creatinine ratio. That's one thing. And then if we're looking for infection, we can also look for a urinalysis to see if there's infection. Now, if someone's getting a urinalysis done and there is a presence of leukocytes, which are white blood cells, nitrates, right, which is showing that there might be a filtration issue or an irritant, and then also the presence of squamous cells and the presence of bacteria. So those are 4 criterion that are often related to diagnosing a urinary tract infection. However, sometimes you can have some of those or none of those and still have a subclinical urinary tract infection. So that is something to remember. If your bladder is achy or tired, or if your kidneys are hurting, it's a very important understanding that you also are susceptible to a urinary tract infection and possibly a kidney infection. If you do that with the urine analysis, you want to get a culture and sensitivity. You want the urine to be cultured and you want it to be sensitive to assess the sensitivity of the different antibacterial medications for the different cultures. So that's what a culture and sensitivity is. It's actually looking at culturing out the specimen of bacteria and then also looking at what the sensitivity is to certain antibiotics related to infection. Now, the other thing about the kidneys is how you can actually assess if someone has a kidney infection. First of all, they're very painful. They ache on maybe usually only one side. The kidneys are connected to the bladder via a tube called the ureter, and bacteria can come up from the bladder through the ureters and into the kidney, causing a kidney infection. Now, this is much more prevalent in women, and kidney stones are also much more prevalent in females just due to the shortened urethra, which is the tube from the outside to the bladder. So that is lending itself to a lot more susceptibility. So let's get back to testing. You can look at imaging. So there's ultrasound, CT, MRI, and they all do a very good job. There's also X-ray to look for stones or blockages. So the kidneys are pretty defined because they're in a shell or they're encapsulated. And then when they have very good visualization. And then looking at kidney tests, sometimes you can see a difference in the shape, or sometimes people actually have a missing kidney, which we never really knew because kidneys can take over the function overall. So you can still maintain high kidney functioning even with one kidney. So that's something to consider, or just information. But horseshoe and polycystic kidney disease are a little bit outside of this conversation today. So getting into conventional approaches for kidney disease, first of all, chronic kidney disease is something where the filtration rate lowers, and sometimes you can use some modulators like ACE inhibitors or ARBs, which is another blood pressure medicine, to regulate a little bit more of the flow that goes through the kidneys, and that can sometimes help reduce kidney disease from advancing. And then also there's certain medications that are used in chronic disease like diabetes and cholesterol, and those are used as well to reduce the intensity from a conventional approach for chronic kidney disease. And then some people in advanced chronic kidney disease will use dialysis. Dialysis can be used for acute kidney injury temporarily, but people who have chronic kidney disease will stay on dialysis with an average life expectancy of 5 to 7 years. And that is the conventional approaches to chronic kidney disease. Getting back to acute kidney injury, which is usually related to infection, dehydration, or a side effect of certain medications. And looking at acute kidney injury, usually if you hydrate someone and you treat the infection, you're going to be improving the kidney filtration rate and they're going to be getting better fast. Kidney stones are another common condition. So those are usually calcium deposits, and they're usually calcium oxalate. So with kidney stones, they have traditionally an approach to look at pain management and then make sure that the kidney stone is passed. A lot of times people will find it in their urine. Sometimes you can use some alpha blockers to stimulate some peristalsis or some movement so that the stones can pass, but they have to pass from the kidney down the ureter into the bladder and out. So that ureter is actually a pretty small tube when someone's passing a stone. And then there's definitely procedures to break up stones called lithotripsy, which means breaking up stone. And then sometimes there's surgery actually to break up stones, because sometimes the stone can be inside the glomerulus, which is like the working component of the kidney, and sometimes they can be actually in the duct system, which is where the urine gets collected. And if there's a stone blocking there, that can be a life-threatening situation because it will block the urine and it will not allow that kidney to function. So those are some common conditions, and then some medical approaches. And while a lot of those discussed were conditions that need to be handled eminently, and whether surgery is needed or sometimes dialysis immediately is needed, those are really things that in some respects are not really negotiable. I mean, if someone has a stone, there needs to be a decision to how to get rid of that stone, especially if it's in the collecting duct or it's large. So that's not really the difference between holistic medicine and conventional medicine. That's actually like the integration of just providing the fundamentals in a very significant immediate need. But let's talk about a holistic approach to kidney health that actually looks at things that are more preventative, and then things that are more able to address chronic kidney disease reversal. Okay, so looking at the condition of the stones, for example. So as I mentioned, calcium oxalate. So calcium oxalate is a deposit that gets stuck, right, and clusters as a stone. Well, how can that happen? One, there can be high oxalate foods, and that has increased recently for people who are using like a lot of fermented foods. So, that can be like, So that has increased quite a bit recently with high oxalate foods like sauerkraut, kimchi. Fermented foods are high oxalating foods. There's a lot of other foods. If you're concerned about this, or you've had a history of stones, you definitely want to look up high oxalating foods and make sure that you're eating those in a reasonable amount. The other foods that have a lot of impact on the kidneys are phosphorus foods. So you really want to avoid high phosphorus foods. And high phosphorus foods are really things like Coca-Cola, processed foods, a lot of like nitrates and things like that. So look those up. They're easy to Google search, and they really can reduce the incidence of recurrence if that's your issue, or lower some of these levels, particularly phosphorus, that has a lot to do with kidney disease. So that's very important. The other things that can help support kidneys, kidney beans. So we talk about foods, right? We can talk about cranberry juice, which is really important for preventing urinary tract infections. There is a lot of research. You can have cranberries, you can blend cranberries, or you can buy unfiltered cranberry juice. You want to make sure to not buy sugar-free cranberry juice, which is not a good idea. It's loaded with a lot of sugar alcohols, or artificial sweeteners. And you want to also avoid just sugar-full cranberry. Okay, so you can get a shot of unfiltered cranberry juice, which is about an ounce, and throw it back and chase it, or you can dilute it with water. But it needs to be that nice, pungent, fantastic cranberry astringent capability in order to cleanse the kidneys. There, like I said, is an excellent amount of research on cranberry juice as a prevention, or cranberry pills if you want to use supplementation with that. And I say, when there's all that research on prevention, and then people argue, well, that's not treatment. And I argue prevention is the treatment. So good for you if you're having recurring urinary tract infections or you're noting kidney disease with a lower GFR. You do want to be thinking about prevention is the treatment. And so getting into a little more information about kidneys, when you look at staging for filtration rate, that really matters. So this is a little bit of how I approach filtration rate with kidneys from a holistic perspective. First of all, what stage are you? So, and if you think about your GFR as a percentage of kidney function, so about 90% is really excellent. So if your GFR is 90, that's fantastic. If your GFR is kind of 80 to 90, that's very, very good. If it's somewhere around 70 to 80, that's okay. 60 to 70, meh. And under 60, we really need to be working on it. Now, that's as the kidney function is declining. And I'm going to talk about how we improve kidney function with improving the filtration rate. The other thing, though, is sometimes the kidneys can be in hyperdrive. So if you're thinking about filtration rate as a percentage, when you get into this idea of over kind of 90, 95%, 100%, I've seen as high as 124% for GFR. That kidney is working too hard. It is doing too much. And that is not a good idea for the long game. So we still want to be looking at that. And sometimes as my patients get better, they actually will then notice a reduction in their GFR to get them closer to that low mid 90s point, which is really like that sweet spot of filtration rate for the kidneys. I just want to make a note, when people get their GFR done by a lot of general lab companies, they also only understand if they're at greater than 60. So they could be at 61 to 105% or GFR, that could be their GFR, or they could be at under 60 and it will actually say what the number is. I don't think people should wait to know that they're at 60 because the lab companies like Quest and LabCorp only have that as their cutoff for their machines, right? So they don't attenuate the machines at a level that will give them that stratification, so you know more precisely what your kidney function is. But there are other companies that do that, and it's really important to know precisely what your GFR is when you look at that, because stage 1 is looking at the 80 to 90 range, and then looking at stage 2 is the 70 to 80 range, and then stage 3 kidney disease is around 60. And that's really starting to be an impressively lowering kidney function. There's a lot we can do to improve kidneys. And so you really actually want to be able to have an objective measurement and an assessment of where your kidneys are, because a lot of times people don't realize they have kidney problems until their GFR is 59, which is less than 60. And although that's fine, you can still recover kidneys at 59. You'd rather know if you were at 86 and then 78, right? That's what I think. So that's an important detail, knowing your staging for your kidneys, particularly if you have some other medical conditions like diabetes, or you've had back injuries, you have chronic back pain, you have urinary tract infections that are recurrent, you've had kidney stones, any kind of insult to the kidneys. You want to make sure that it is not long-term persisting as an impact on the kidney for chronic kidney disease. So we talked a little bit about cranberry, which is amazing. We also work in my clinic with a supplement called Kidney Care. Now, this is an herbal and mushroom blend that I have vetted in my clinic for years, and the results have been remarkable. You can reverse kidney disease, and there is definitely the ability to do it with an herbal and mushroom blend. It's been fantastic. I have had a few times where the patients have vacillated down, up a little bit, and it's because there's also a structural consideration. Those kidneys, like I said, are really tightly wrapped in the retroperitoneal cavity, and so they don't have any shifting, right, that can go on. So if they're getting squeezed, scrunched by muscles that are too tight, or the rib cage is pushing down, or there's some abdominal bloating that's consistent, etc., those kidneys can get a little bit tightened, and that compression can reduce filtration rate. So this is where physical medicine really plays in to do things like open the diaphragm, right? If you're having struggling breathing, your diaphragm's probably pretty locked, and that's trapping the space in the back as well where the kidneys exist. So that's important. Another important thing, which I'll give you a technique. So this is if you have a prostate. What you want to recognize is that the kidneys filter through to the ureter and then the bladder and then the urethra. And then the urethra has to go through this donut, that shaped gland called the prostate. And when the prostate gets tighter because of pelvic floor restrictions or fatigue and things, etc., that prostate, you actually want to go into the peritoneal space you want to go in the perineum. You want to go on the pelvic floor. What you want to do with this technique is you want to go to the perineum or the pelvic floor where there's skin in the middle of the perineum, just between the scrotum and the anus, and you want to apply a direct pressure that's not too forceful for about 30 seconds. This will help support the pump of the prostate, and it will also allow for the urine to be able to drain better out of the GU system so that your kidneys will not have that backflow. That's an important thing to do. It's very easy. You can do it at night. It's very simple. The other thing is to make sure that you are voiding on a regular basis. It is very important that you urinate approximately at least every 4 hours. For people who have made it like a warrior kind of approach to not urinate all day long, what actually happens is they can torture the organs, right? And the tubing so that they become tortuous because of the backflow. And so backflow is a huge impact on the kidneys and can be very severe. So why do that? I don't know, not a good idea. I have met several people who have more of the pelvic floor issues that then can backflow and affect the kidneys. And so it encourages you to maintain basically urination about every 4 hours while awake and then before you go to bed and when you wake up so that you can allow for the rate to happen and for the kidneys to not get backlogged. So that's a physical medicine approach to kidney health. That's an understanding of the function follows form. So when the form is disrupted, the function will be disrupted. And then there's just a lot of nutrients that support us, either through food as medicine or supplementation. It's very helpful. And then also actually just knowing your numbers, know your filtration rate. That is just very important because if you don't want to be all of a sudden aware of a declining GFR, because now you're at the threshold of less than 60 when you could have done something a little more effectively if you were a little bit higher. But don't worry, these tips can definitely help with glomerular filtration rate increases or GFR increases. There are also some awareness now of changes in implementing dialysis too early. And so there's been some changes, particularly in Canada, of making some alterations in when to start dialysis, and it's much, much later than it used to be. And that's very important because hearing the word dialysis is awful. Dialysis is definitely something that we need to make sure that is not on anybody's list because it's an awful experience. And you want to understand, like I said, your numbers. You want to understand how to reduce some toxins that affect the kidneys. So that's oxalates, it's calcium. It's particularly people who also take calcium, particularly men. Very rarely do men need to supplement with calcium. So if you're throwing stones and you're a woman and you have calcium oxalate stones, you want to make sure that you're aware of calcium's positives and negatives. And if you're a man throwing stones, which is a lot more unusual, you want to make sure too that you're avoiding calcium supplementation. That's very important. And I just want to thank you very much for your time today. I look very much forward to discussing organ health and how we can make a stronger a stronger you. Many blessings, and I hope you feel better and then you feel great. Have a great day.